I'm Dr. Sushantssoni. I'm MBBS MAMC, MD Pathology UCMS and GTB Hospital, resident Hemato-Oncology, AIIMS Delhi. I am telling you my credentials because we are today discussing how to prepare for May AIIMS 2020. So you need to know that the person who is telling you this has the right background for telling you the same. Firstly, next, now I guess there's slight lag. Just a sec. If you are able to hear me clearly, please give me a thumbs up. Okay. So this starts us with how to prepare for mains. Firstly, bache, be very certain. Clearing the media paper is like comparatively easier as compared to the November central exams. I'm saying so because majority of the students do not have the mindset for preparing for the paper at this point. They are either busy waiting for the NEET or the All India result. Firstly, they are busy in that, or they are slightly depressed about how the paper went. So basically, they are not. Firstly, they are busy in that, or they are slightly depressed about. Just a sec, which I need to check the one. Okay, so they are not preparing for the mains as such. They are not preparing for the mains as such. Let us now start how to beat this trend. Firstly, have a dream. That is the most important thing. During this point, you should have the right mixture of anger, frustration, and the zeal to prove yourself. I'm not kidding about it. AIIMS is one of the toughest exams all over India. We guys, after it is always said, there is AIIMS, then there are rest of the colleges. I am not being snobbish about it. I am telling you this as a fact. Once you clear the paper, you will be at a different level. So have the zeal, have the ability, or have the motivation कि मुझे तो निकालना है. I have to clear the paper. First, that is the most important thing. Have faith on yourself. It has absolutely nothing to do with how you fared your MBBS, how many distinctions you got or how many you did not get. I myself did not get even a single distinction. I was always a very intermediate level student who neither topped nor was in the bottom half. So I was intermediate. It absolutely does not matter. Your NEET rank does not matter. The only thing that matters is how well adapted you are in these 4 months. We will be seeing that, plus how smartly you study. These are the two most important points. Next, the three hormones, the serotonin, dopamine, and acetylcholine, keep them in balance. You should neither be too happy or satisfied. Serotonin is for happiness and satisfaction. Dopamine is for love and passion. What we have seen during this time, I mean, I am an educator for the past 7 years. What I have seen is either the students are way too content after NEET, they have put in their best. They are like, nahi, I cannot study more. Nahi bache, this is your absolute last paper. NEET, if you have cleared, fair enough, but you are already at a level. Why don't you give yourselves another chance and clear the best of all the papers? Next, acetylcholine. Learning, dreaming, daydreaming. It is the dreamers who get selected, and of course, memory. So let us start with the strategy. Each student is different. I can tell you what helped me. Dekho, assuming this is today's 15th January, assuming that you will not be studying for another 3-4 days. After that, what needs to be done? There are 15 weeks, 19 subjects. First and the foremost thing, make a schedule. Most important thing, making a schedule. Wasting time at this point is disastrous. We have already seen, consider it your last exam. If I was in your position, how would I have made the schedule? We can divide the subjects into 3 categories: the major subjects, the minor subjects, and the ultra short. We have 10 major subjects: Anat Physio Biochem, first year, second year Path Pharma, third year PSM, final year Surgery Medicine, Peds Op Gynae. These are the major subjects. What I will recommend you is give 6 days per major subject. give 6 days per major subject, that is 60 days. 60 days roughly transforms into about 9 weeks, 9 to 9.5 weeks. Next, the minor subjects. Second year, forensic micro, third year, ENT optha. These are the minor subjects. To the minor subjects, give 4 days per subject. Give 4 days per subject. 4 days, 4 subjects, that is 16, that is approximately 2.5 weeks. 2.5 weeks. I am again saying this, every student is different, but this is the ideal schedule. You cannot afford to leave a subject while preparing for AIIMS, firstly. Secondly, usually till about last year I used to say that the only subject you can afford to leave at this point is medicine, but I will not suggest you this at this point, because you know that from the NEET in the NEET paper, out of 300, close to 200 were the clinical based questions, so you need to revamp your medicine again. Finally, your subjects medicine, surgery, peds, obs, gynae, they have to be done. You cannot afford to leave medicine at this point. Next, lastly, are the 5 ultra short subjects. Ultra short subjects, give it about 2.5 to 3 days per subject. 2.5 to 3 days per subject, that is around 10 to 12 days, making it approximately 1.5 to 2 weeks. Making it 1.5 to 2 weeks. This in total, we in hand have 15 weeks. The first reading that I have told you, 6, 4 and 2.5 days per subject, would take care of 13 weeks. This takes care of approximately 13 weeks. Next is the revision part. When I say revision, lastly, revision. The topics, there are numerous topics from each subject which have to be memorized. They are not understanding based. The revision is in the last 2 weeks. Mark the topics you are going wrong, mark the MCQs, do the questions fast. This is not the time to build up your concepts at this point. I am saying this very frankly. This is the time to do the questions, go further. Every year has 10% new questions. 10% of 200 is around 20 questions are new in every AIIMS paper. So do not spend a lot of time on those toughest of questions. They being the chances of those getting repeated or even those topics being repeated are less. Study smartly. I will tell you how that is to be done. With respect to pathology, of course you know that topics are repeated, not the questions. We divide pathology into 3 parts. General path, hemat and systemic. Pathology, there are around 20 to 25 questions which come from pathology in every AIIMS paper. This is the trend we are seeing in the previous 3 years. The majority of the questions are from general path. General path has around 10 to 12 questions, followed by hemat and then is systemic. In hemat, RBC and bleeding disorders, this is usually the trend that is seen, has around 4 to 5 questions. Oncohemat has 2 to 3 and the remaining 6 to 7 are from systemic pathology. This is the breakup. Out of this, though majority of the questions are from general path, but the most important rank deciding is oncohemat and systemic pathology. These 2 topics are the rank deciders. The general path questions, majority of the top rankers, that is the top 5,000 students, are able to do them correct. What decides the rank is oncohemat and systemic pathology. Firstly, next, this was the strategy. So firstly, make a schedule. Next, now we are having this discussion. I am not going to discuss the answers or something in this. What I am concerned about is how to prepare smartly. See, as faculties, we can guess the important topics, or we know that this is an important or an upcoming question or a prospective question. How do we do that? I am here to tell you that thought process. See, the previous 3-year papers decide the topics. May AIIMS 2019, that is last year, they gave this question of match the following. You had the Howell-Jolly bodies, which were the nuclear remnants, the doll bodies, which were remnants of endoplasmic reticulum. Flame cells were the immunoglobulin inclusions versus all rods that were eosinophilic granules. Not interested. What I am interested in telling you is the examiner gave you Howell Jolly and all bodies, which was from RBC disorders, flame cell and all rods were oncohemat. So the next level of question and the next question or the next prospective question in the mind of the examiner is, let me ask you the images. This is how the examiners think. How are papers made? Let me tell you that. Though I resigned from Assistant Professor AIIMS last year, but how the paper is made is every faculty, say in pathology, there are say 10 faculties. Each faculty is asked to give to the national board around 8 to 10 questions. So 10 faculties, 10 questions. You get a set of 100 questions. Out of those 100 questions, 20 or 25 are picked randomly. The same is done for all the subjects. This is how AIIMS makes its paper. Now, so what we saw was they can ask the images. So if I was in your position, the prospective image that can be asked is the rank deciding will be doll bodies, because students can confuse this with toxic granules. See, Howell Jolly frame cells and all rods are extremely easy to recognize. That's obvious. Doll bodies. What you see here are the light blue oval basophilic inclusions in the peripheral cytoplasm. These are the remnants of rough endoplasmic reticulum. These are doll bodies. So this is how a prospective question is framed. Next, this was May AIIMS. Now, November AIIMS 2019, that is 2 months ago, they asked you the Maltese cross sign. So what they were doing were, they were on the images of RBC disorders. The first was the match the following with respect to images. Next, Maltese cross sign, babesiosis. You know this very well. And you again know that this is the Maltese cross sign seen with babesiosis. It's not always a cross, it can be in the ring form also. Next, so what did the All India examiner do? In All India, that is this January NEET, we are talking of the same pattern. See, the first asked you the match the following. Next was an image based question from a similar topic, and next an image was given. This January NEET, that is 2 weeks ago, you were asked the Ecole form. Of Plasmodium falciparum. This is the Ecole form, which shows the presence of ring forms with Morier dots. And this was the banana shaped gametocyte. Not interested. What I am telling you is the thought process. Next, let us see another example of the same thing. November AIIMS asked you which of the following is not a cause of severe combined immunodeficiency. ADA deficiency, IL-2R receptor mutations, JAK3 mutations, all the first three were the causes. NADPH oxidase was not. NADPH oxidase defect is associated with chronic granulomatous disease. It is associated with chronic granulomatous disease. This question was from diseases of the immune system. In which we divided the diseases into adaptive, that is we divided them into innate and adaptive diseases. Innate were LED1, 2, Shinya-Higashi syndrome, chronic granulomatous disease and MPO deficiency. Adaptive were primary and secondary. Secondary adaptive was HIV. Primary were divided into B cell, T cell and combined B and T cell. So this was SCID. This was combined B and the T cell primary adaptive disease. We have discussed this already in the November AIIMS discussion. We did this extensively. This topic was repeated twice. The same paper, they gave you a flow cytometry in which diagnosis was asked. Normal was 19 positive, 40 positive, CD 19 positive, CD 40 positive. This was normal. And the patient that was asked, this was a flow cytometry dot plot. The patient that was asked was 19 positive, 40 negative. making the answer as hyper IgM syndrome. Now the answer in this case is not important. What I am telling you is, see, the next prospective level of question which can be asked from this, the next prospective level that can be asked from this are dot plots in flow cytometry. Dot plots in flow cytometry. This is how you study smartly. This is how we guys make the paper. Dot plots in flow. How? Dekho, this was a dot plot which was given. So next they can ask you a 45 side scatter dot plot, 34 side scatter dot plot, or a forward scatter side scatter dot plot. We will be doing all that. Next, the next question that can be asked from this, they have already asked you fish. That fish, it was a written question. Fish was the investigation of choice for detection of fusion transcripts. So they can ask you the fish images, fluorescent in situ hybridization. They can ask you the fish images. Next, what can also be asked are the other genetic techniques of detection. Other genetic techniques of detection. For the same, this was November AIIMS. The same was asked in the January NEET, that is CRISPR. So this is how the topics, the prospective questions are decided. Next, January NEET from the same table or from the same text asked you this question. 5-year-old child with history of recurrent infections, rashes with low platelets. Recurrent infections, rashes which was shown here, and low platelets. This was Wiskott-Aldrich syndrome. So all the questions, the previous 3 questions, November AIIMS, January NEET and May AIIMS, they were linked from the same topic. This was Wiskott-Aldrich syndrome associated with VASP protein mutations present on X chromosome. Wiskott-Aldrich, that is, it is an X-linked mutation, VASP protein. So the next level of question is, clinically they have already asked you thrombocytopenia, eczema, recurrent infections, you know this. Next prospective question that can be asked from this is the antibodies. The antibodies, it can either be match the following, true, false, whatsoever. I always remember it as the people who say G cell, they remain normal, that is IgG is normal. The ones with AM, that is AM the main person, AM is low, whereas A and A is increased. This makes it a prospective question. Next, what was asked with respect to oncohematology last year in May AIIMS was vegetarian with easy fatigue. Investigations revealed TLC was low, hemoglobin was low, platelets was low. That is, it was a case of pancytopenia. With low retic count. So what is the least likely diagnosis? All four can present with pancytopenia. Asha, before I go further, tell me the answer, bache. What will you mark in this? Tell me the answer. All 4 can present with pancytopenia, but least likely, a splenomegaly of 3 cm does not correlate with a full-blown primary myelofibrosis. A patient of primary myelofibrosis, we expect splenomegaly to be bigger. We expect it to be massive splenomegaly. MDS, megaloblastic and AML, they can have pancytopenia. Next, a variation of the same question. What I was told was that the investigations given were TLC was 31,000 per microliter, platelet count was reduced, that is 95,000 the same, and hemoglobin was also low, that is 7.1 grams per deciliter. So in this case, same question, which is the least likely diagnosis? Same options. In that case, the least likely becomes megaloblastic anemia. Why? Because a patient of megaloblastic anemia, least likely with the same options is megaloblastic anemia. Because a patient of megaloblastic anemia, we cannot explain the high TLC. So if the prospective questions from oncohemat have to be searched upon, they become AML and MDS. They become AML and MDS. Combine it with flow cytometry dot plots, which is used in AML, making it an extremely important topic. Making it extremely important. Next. November AIIMS. November AIIMS gave you this pretty straightforward, easy question. A 8-year-old child, that is a child with 3-day history of edema, facial puffiness, BP is slightly higher, mild proteinuria, RBCs are present. RBCs are present, most likely diagnosis. This is a case of nephritic syndrome. This is a case of nephritic syndrome. And the most common cause of nephritic syndrome in children is PSGN, post streptococcal glomerulonephritis, PSGN. So November AIIMS asked you a question on kidney in which a written question was given. So the next level question that becomes important are the images in kidney. This is the trend we are seeing. Both the immunofluorescence, the light microscopy images and electron microscopy. If written has been asked, the next level is obviously the images. So the January NEET, in the same, they gave you nothing. They simply asked you this image, diagnosis. This was an electron microscopic image showing you this was the basement membrane with diffuse effacement. Showing you the diffuse effacement of foot processes. Diffuse effacement of foot processes of podocytes, making the diagnosis as MCD, minimal change disease, making the diagnosis as MCD. So the next perspective question, electron microscopic images of other organs or other diseases of the kidney, PSGN, which shows humps, MPGN, the splitting of the basement membrane, Alports, splitting of lamina densa. These become the prospective questions which we will be doing in our session for the quick revision session of May AIIMS. But this is how the topics are repeated, and as faculties we are pretty adept at guessing that. Next, this was normal. Let us just have a quick look at this. This was normal. This was the lumen of the capillaries. The basement membrane, showing all these as podocytes. These are the podocytes. Versus this was the diffuse effacement. This was the basement membrane, diffuse effacement of podocytes seen in MCT. Next. So the next question, this was the May AIIMS 2019 question. Mark the statements true false. AL has kappa light chain, true. SAA is the most common in Mediterranean fever, true. Mediterranean fever, the protein getting deposited is AA, so true. Next, senile amyloidosis is due to beta-2 microglobulin. Nahi bache, this is false. Senile amyloidosis, this statement is false. This is because of A beta. Senile amyloidosis, A beta. Beta-2 microglobulin, this is associated with hemodialysis associated amyloidosis. Next, on Congo red, amyloid shows apple green. This is true. So true false was asked. I don't know, something is going wrong with my pen. True false was asked. So 1, 2 and 4 were true, 3 was false. So this makes the prospective questions as amyloid, the master chart, amyloidosis. Next, how do beta plated sheets look on X-ray crystallography? Next, electron microscopy of amyloidosis shows branching and non-branching. It shows non-branching straight fibrils. Electron microscopy of amyloidosis, it shows non-branching straight fibrils. All these are the prospective questions which we'll be doing, because they combined electron microscopy, which they as such they are asking, and a question on amyloidosis. Next, again, previous May AIIMS asked you, hepcidin inhibits. Pretty straightforward. Hepcidin inhibits ferroportin. Hepcidin is secreted by liver. Increased hepcidin inhibits ferroportin. You know this. Now, so iron transport was being asked. So November AIIMS asked you, which is the best indicator to assess iron deficiency anemia? The storage form of iron in peripheral blood, that is serum ferritin. So the same topics are being repeated, and the prospective question from iron deficiency anemia becomes the normal values. Next, stain for amyloid is Prussian blue. Stain is Prussian blue. So they can give a Prussian blue image. And excessive iron deposition, hemochromatosis from liver. This makes it the prospective question from the same topic. So what I am trying to stress upon is, when we will be doing the previous 3 years papers, I'll be launching a crash course for May AIIMS from the month of February. In the first week of February, I'll be launching the crash course for pathology. We will be discussing the previous 3-year papers in detail. Every year there were 2 papers, May AIIMS and November AIIMS. So we'll be discussing those 6 papers. We'll be dissecting them thoroughly, doing the prospective questions from the same topic, making it a complete package for May AIIMS, at least with respect to pathology. Next, blood banking. The only topic which was favorite of both AIIMS as well as All India. You had close to 7 questions, which came in 3 papers in blood banking. This was the only topic which was repeatedly asked. Chronic kidney disease patient, CKD. Chronic kidney disease patient, his hemoglobin was low, so he was given 2 blood transfusions. The first bag was given within 2 hours. When the second bag was being given, he developed hypertension. 180 by 100 millimeters of mercury. He developed hypertension, pulse was 110, which is the most common cause. Answer, TACO, transfusion associated circulatory overload. In the actual exam, this is AIIMS exam question, in the actual paper last year AIIMS, the students were confused between TRALI, transfusion related acute lung injury, and TACO. TRALI, what was favoring TRALI? TRALI was being favored by the students because it develops at 1 to 6 hours post blood transfusion. But the point to be noted in TRALI was, it is not associated with hypertension. Versus TACO, transfusion associated circulatory overload. This is seen in renal disease patients, heart failure patients, and pregnant patients. This history was that of a chronic kidney disease, making it as a renal disease patient, transfusion associated circulatory overload, and this is associated with hypertension. Next, 3 questions which came just in the AIIMS paper with respect to blood transfusion. Thalassemia with needs of recurrent transfusion, but it develops transfusion-like fever, transfusion-like reaction. To reduce, what can be done? And the answer was, what should be given was leukocyte-depleted blood transfusions. Because if we irradiate the patient, then even RBCs will reduce. So once an adverse reaction develops, leukocyte depleted. Next, so the prospective questions had to be on leukocyte depleted, how the bag looks like and stuff, and the same thing was asked. You were asked a blood bag which was leukocyte depleted. Next, another important favorite topic was bleeding disorders. In which they asked the clotting factors to be arranged in the sequence. So pretty easy answer. It was 13 followed by 12, 9, 10, 13 is not the first one, my mistake. 12, 9, 10. 12, 9, 10. 5 followed by 13. 13 was the fibrin stabilizing factor. This was the sequence. But that's not important. What is important is the next question that came from bleeding disorders was they asked you intrinsic clotting pathway test. Intrinsic pathway tested by APT, extrinsic pathway by PT. These are the previous papers, the previous MAIIMS and the November AIIMS which was asked. So prospective questions from this becomes the master chart, of bleeding disorders, and because clinical histories are being asked, they can give you a clinical history either of adult bleeding, child bleeding, investigations, and you will be asked to make a diagnosis. We'll be seeing that. So this is how the questions are framed, and these are the important topics. Next, so I will just like to end it by November AIIMS gave you a pedigree. They gave you a pedigree, inheritance was asked. Obviously, if the mother was affected, all the kids were affected. Mother was affected, all kids were affected. If the father was affected, none of the kids were affected. This is classical mitochondrial inheritance. From the mother, it was going to all the siblings. This was mitochondria. sorry. So the same thing, the same pedigree chart was repeated in January NEET. And this was the image given 2 weeks ago, and you were asked to make a diagnosis. If the one parent is affected, 50% of the kids are affected, irrespective of the sex of the child. This was classical autosomal dominant. So the prospective questions from this becomes that they can give you either the diseases with Mendelian inheritance, non-Mendelian inheritance, chromosomes, Prader-Willi and stuff, Prader-Willi, Angelman, the chromosomes 15q can be asked. Next, they can give you the pedigree chart of X-linked recessive, or percentages can be asked in a clinical setup that mother had a HbA2 of this percent, father this, risk of baby to be thalassemia minor or major. These are the prospective questions from these topics. So to wrap our discussion up, I just want to say, as Martin Luther King Jr. have told us, the time is always right to do what is right. Do not be under any misconception that our preparation is not up to the mark, we are feeling too low, how will we clear AIIMS, we have never topped our MBBS paper. Absolutely does not matter. Absolutely does not matter. If you sit and study with concentration, you will be able to do it. The time is right, provided you start ASAP. You start soon. Do not waste your time in waiting for the All India result, firstly. Next, do not be distracted. Make these 3 months your only target is clearing the MAIIMS paper, nothing more than that. This is your last exam. And these are the 3 words which have helped me very often. Pray. It has a huge power. Work hard. And in the end, trust God. Because what will get you selected is, my grandmom always says this, locking the key to success, unlocking the lock of hard work or success. You need 2 things: hard work and faith. Have both and you will be successful. Needless to say, bestest of luck for the exam. Take care.